Looking to grow your behavioral health practice and reach more clients who need your help? We have just the solution for you. Psych Hub Provider Learning Hubs are your answer. We will train you in the greatest information on evidence-based practice delivered by industry experts in a state-of-the-art way. And at the end of it, you will earn a certification in how to use these interventions to treat anxiety, depression, insomnia, you name it. And then when you finish, you unlock a whole library of resources for ongoing learning for you as the provider, but to share with your patient. How great is it to let your patient know in a quick video, here's what to expect from your therapy session. And then any exercise or activities that happen in session, we have videos to help reinforce those skills at home for your patients, as easy as just sending a quick text or emailing them. It is a revolutionary new way to really get people through treatment, getting the best symptom results, and engaging your patient along the way. Visit psychhub.com/learning to get started. Hi, I'm Marjorie Morrison.
And this is Patrick Kennedy.
And you are listening to the Psych Hub podcast, The Future of Mental Health. Did you know the average person spends 90,000 hours of their life working? That's over 1/3 of your life. And that's just assuming that you're working a 40-hour work week. If you're people like me and you're putting in 50, 60 hours a week in these COVID worlds, it's even more hours. And then taking in consideration that it's estimated that up to 80% of workers hate their job. Burnout is one of the biggest challenges these days for employers, especially during a pandemic. But building a resilient workforce is the best thing you could do for productivity. That's why today we're excited to have Dr. Lisa Desai on. She's a behavioral healthcare director for MindWise, and she's going to cover all things in workplace mental health, like how to manage a company culture where people are coming in from all different perspectives, and micro-labeling, a term I honestly had never heard of until this episode. And last, but certainly not least, trauma-informed care, which we obviously love talking about at Psych Hub because it's a course that we're in the process of developing for providers. With Dr. Desai's 25 years of clinical experience across college counseling, community mental health, hospitals, and private practice, you're going to learn why it's imperative we don't leave out the workplace when we think about shaping the future of mental health. I know you're going to enjoy this episode. Lisa, thank you so much for joining us.
Thank you for having me. I'm delighted to be here.
Can you tell us about how employers can balance employee mental health and still focus on getting the job done?
Sure. And, a lot of what we do at MindWise is in the realm of looking at behavioral health through a very large continuum. So looking at kind of healthy behaviors when folks are struggling, ranging from risk factors for suicide, substance misuse, and then what can you really do to build in resources for folks? So, from our perspective and the work we're doing, I very much feel like balancing mental health and addressing mental health is part of getting the work done. When you look at the rates of absenteeism, presenteeism that are connected to mental health struggles, it's really imperative that leaders start to recognize and are recognizing that building a resilient workforce is the best thing you can do to have productivity and quality of the productivity, not only the quantity of the productivity.
It's so intuitive, right? Like, of course, if you are focusing on your mental health, you're going to be more productive at work. But yet, as an employer, I think sometimes people feel like that is a distraction maybe, and that it's a takeaway. So do you feel like you have to work hard to message that?
Yeah, it's interesting. We've known in doing this work in behavioral health that this mental health in the workplace has been around forever. We needed to address it. For many years, it was leave your baggage at the door. COVID in that way, I think, has been an equalizer of sorts. If there's any small silver lining, it's that people are talking about mental health more. And so we're finding that workplaces are more open, and partly because they recognize that there was a crisis at hand they needed to deal with, and thinking about how do we support workers when they're back, whether they're hybrid, they're fully remote, they're back on site. And we're very much about how are you using this information to plan for the future?
I love that. And I think it's great that you're leading from that because, it sets the stage. It's the first time I've heard that kind of like leave your baggage at the door, but it makes sense in everything you're saying. So have you seen employers like change in what they want employees to disclose about their mental health?
That has been a tricky situation for a while because there's and understandably there's concern about employee health information, really protecting employee privacy. So yes, there is concern that if we start talking about this in the workplace, what is the fallout of that going to be? Um, you know, I think my position and our position is very much it's going to get talked about, it's going to be brought up. And so, where are you as leadership, as HR, in being prepared to address that conversation? So, for us, it's not, dig around for information, ask how people are doing in terms of feeling depressed or anxious, but be prepared when it comes up. And in the future workplace, millennials, Gen Zs, and beyond are incredibly comfortable. It's great. They're very comfortable talking about their mental health, their therapy, medication. So more and more employers have to be ready to have the conversations.
I could see that it would be hard for them too. Have you seen employers making kind of changes or shifts in how they're paying for things, like their overall kind of packages about investing in mental health resources?
So we don't hear, I don't hear details about how they're putting together the packages in terms of monetary. We do know that when you look at the impact of the mental health aspect of healthcare costs, depression alone outweighs other risk factors like smoking, obesity, in really adding to healthcare costs in general. So what we do know is if you're addressing healthcare, you have to think holistically and address the mental health picture of healthcare.
We're in a position now where we have, kind of this focus on equity and kind of the long-standing recognition that in our country we have systemic institutional racism in the way we provide opportunity, and then of course programming wise, and just in our understanding of our place in the world. There's kind of a little bit of a lack of humility and understanding as to how deep this runs and how pervasive it is. We confine our view of this as, well, we're not racist, but that doesn't negate the fact that as a culture and a system, there are huge disparities in outcomes that are really driven by disparities in opportunity, that are driven by these cultural norms that create the cultural implicit bias that we're not aware of, or some may be, and that's more overt racism. But could you talk just generally as someone who's interested in this space, to how that factors into kind of mental health, in the workplace or just in general?
Yeah, so we know that certain populations certainly are more affected, we know, by racism. So during COVID and during the national unrest in our country, the Kaiser Family Foundation did a study 3 months into COVID in terms of who across ethnicities and races that were part of this study, who was more impacted. And far and away, Black Americans were more negatively impacted in their mental health. And that is about, and I think it's really important to be clear, it's because of the stressors and because of what they experience that their mental health was impacted more negatively compared to Latinas, Asians, and white Americans. Now, interestingly, the second most impacted group in that study were Asian Americans. And I think lots of folks suspected at the time of the study that it was due to the stereotypes and the misinformation that was coming across in terms of COVID, the origins of COVID, how it was sustained, and how that was linked to the Asian American population. In terms of looking at mental health, inclusivity in the workplace, it's really interesting. We're getting much more interest from organizations that would like us to work with them around how do you put together an affinity group? How do you identify which affinity groups or ERG groups, employee resource groups, might be useful, might be needed, might be important in an organization? And a lot of what we stress in those conversations is if you're going to stand up an affinity group, ensure that it is integrated throughout the organization. Ensure that it's not sitting over here in some little box. So you can say you've given a voice to some folks. It's important that that voice informs policy, informs leadership, and truly is integrated.
It's an excellent point. We have our mental health ally certification at Psych Hub, which is a series of different modules. And we have two around diversity. And it's really kind of interesting how it evolved. It's diversity in mental health, but it covers like so much more than even just race and color. And I don't know if you've seen it, but I think it really challenges even when we think about diversity and inclusion, because we talk about size and we talk about geography, which is something I never thought about. Something you might have a preconceived notion about somebody who lives urban compared to somebody who lives rural, and just and gender and sexuality, and it's a very fascinating conversation. We're very quick to put color to it, at the face. And yet I think you brought up a really good point about cultures also where you live within our own country. And it is also just so fascinating to me about, the old expression that birds of a feather flock together, that people find people like them in these different areas, in any of these kind of subcultures, and you find these groups. And if we could really figure out the mental health issues from these different groups, we know the target audience is where to find them, but I think the move is hard. And then I was just reading this morning about 45% of people that are struggling with some mental illness over the age of 65 don't even have broadband, don't even have internet. So, I think even age can be considered at some point, a diversity. So I don't know if you've given some thought to this. It's really kind of a wide open question here, but I am really fascinated about it.
I have to admit, I did watch that part of your ally training. It was incredibly well done, the diversity training. So yeah, I do think about that a lot. And I also think about the communication between groups, between diverse groups. And for a while, I worked at Wellesley College, and in college counseling, developmentally, it makes a lot of sense for college students to embrace their own identity. It's a part of their lives where they want to be in the Latina club, the Black American, the Black women's organization, so on and so forth. And again, what happens is they get siloed. So there's not communication across. Mm-hmm. So that's what I find really fascinating, is how do we solidify folks' identities, whether it's in the workplace or outside of the workplace, but then also facilitate conversations between. So, speaking of urban, rural, when I was younger, between the ages of 10 and 15, lived in a town of 800 people in Ohio. So, wow. I loved it. One of my best friends is from that time. But I don't think of myself with that mindset at all. I think of myself as a very urban, but I loved having that experience, which really informed a lot of my thinking.
That goes to, everybody knowing your name, so to speak, and everybody knowing your business, right? So we're in a new world because, you focus on children and child development. Kids are experiencing a new child development trajectory, and that is that they have two selves. They have their, social media self, and then whatever is they feel they have on their own or that's personal. And of course, we all in our lives are trying to always reconcile them, but it's probably made a lot more difficult for kids when social media is so dominant early on in your search for identity. Could you talk a little bit about that in terms of affecting mental health for young people?
Yeah. So in the MindWise work, I'm not, and even clinically for years, I've not worked directly with children as much. What we know from our SOS team, Signs of Suicide team, and what we know from the press, what we're reading every day, are very, very, very tragic stories about youngsters, middle schoolers, high schoolers that are feeling suicidal, that are even dying by suicide because of that isolation. And, even within our MindWise team, we'll say some of our kids are tired of being online. You'd never think you'd hear the day where they were tired of being online. So social media, certainly that's a big conversation in terms of the pros and cons of that. I think being connected through through Zoom calls and so forth has been helpful. It'll be very interesting to see the outcome of this year on children, on adolescents, and college students 3 years down the road. I believe there's a lot of resiliency that's been built. I believe there's a lot of loss that's also happened during this year. So it will be fascinating and hopefully lots of learning for us in the next few years.
Yeah, I mean, I can't help but think that we're going through one of those adverse childhood experiences right now.
Yeah. Yes.
And
Yes.
we're so focused these days on understanding the impact on kids of adverse childhood experiences and trauma and what happened to you. Um,
Yes.
I think
Yes.
that this is going to be a really formative moment in terms of galvanizing people around earlier childhood screening and development, because if you, as you said earlier, the kind of silver lining, if you will, as people are talking about it, I think another silver lining is that there'll be a realization that this has to be more core to everyone's development, and we can't take it
Yes.
for granted. Could you talk a little bit about how you think about that, having spent time at some of the most prestigious child and adolescent programs in our country, and then kind of what you've seen throughout your own life?
So, absolutely. Screening early, screening regularly is so important. It's also important to then be prepared for once you screen and you identify that there's certain needs, what are those programs? I think the other part about screening, and we offer a screening program for adults. The thing about screening is I hope that it's from an educational perspective as well as a you're screened in, you're screened out. Because, if you think about mental health on a continuum, we're all somewhere on that continuum. We're moving around on that continuum. So if you're screened in, sure, you're struggling. But if you're screened out, it doesn't mean that, you don't need anything. I think it is um, really thinking about it is that I think you kind of alluded to it, Patrick, this trauma informed care approach of let's build in supports for everyone, and focus on rather than what's wrong with you, what happened to you.
I really like that, Marjorie. We're discussing this idea of, and I've been pushing it kind of from a policy vantage point, but of course, we've been delayed in getting these mass vaccination sites up and rolling, and of course, this how slow the kind of rollout has been. It means that we've got the super majority of our American public haven't been screened yet. I mean, haven't been vaccinated yet, and that it does offer an opportunity to get to everyone. Like, this is one moment where you're going to get every demographic in the country in front of you, collectively speaking. And wouldn't it be a game changer to incorporate some kind of SBIRT, screening, brief intervention,
Mm,
referral, or treatment into that, understanding that COVID also means a spike in stress, and for many people, spike in depression, anxiety, and for also amongst those folks, a spike in risk for suicide. So why wouldn't we, if we're to try to think about this epidemic of mental health and addiction, not try to overlay our public health response to COVID with a response to the epidemic within the pandemic? And then I think, as a policymaker, politically, there's advantages to it, because for the general public, now they start to see that the integration of mental health into overall physical health is what we
yes.
should be expecting. And I think it's like the best anti-stigma campaign you could run is to do this. Um, and Marjorie, through Psych put together a great, cover, what is it? Mask your face, not your emotions. I don't know what it was, but your crew came up with a great one, Marjorie.
Oh, I
It's
like
our
that.
crew, ours, yes.
I'm always giving you credit.
Throwing it back at him.
Got to throw it back. Um, But I mean, I think this is a formative time. I love that screen in, screen out, though.
I do too. I really appreciate it because a lot of times we think about it like a thermometer, right? So it's like you're high or you're low on it. But the truth is that if we really want to get to these issues early, we got to be proactive with it, and that's got to be when you're not even at 98.6, you're at 97 or something. So I got low temperature, but that I think is really important. And we talk about it a lot too. I mean, if we want to make an impact in mental health, we got to get to people earlier. So we have to be careful with these screeners. We actually just had a conversation about it this morning, as what he was saying. We have our COVID-19 mental health resource hub, and putting a screener on there when you first get to it, when it has, I don't know, 25 different partners, and it has all these resources, but the screener to choose is very hard because of this exact issue. It's like you don't want somebody to fall off or think, oh, I'm fine, so I'm not going to worry about it, when really we all struggle. We pitch this stuff all day long, but and some days we do better and some days we do worse, and some days we're more resilient. And I mean, that is life, and that's okay. I mean, that's part of it. But it is an interesting time where that, like you, like myself, like Patrick, we've been in mental health for decades. And so to see everybody talking about it now, it feels like a moment, and it feels like we need to grab it. And at the same time, it's hard. There's no silver bullet. There's no right answer. We have access issues. What do we do if we screen everybody? Everybody wants care. There's just concerns about it along the way. And have you thought about this much?
Yeah. And the proactive, what you said, Marjorie, about proactive is absolutely a big focus. I think in general for organizations, starting early, when we think about the screening, or we think about, okay, take a screen, take a self-assessment. It's very much educate yourself, learn the language a little bit, so that because if we're going to be having these conversations about mental health, we need to know how to talk about it. Very interestingly, in terms of catching early, if you think about the future workforce, we've been doing a lot of work and paying attention to the current workforce, but also the future workforce. So high school students, trades, people in the trade schools, apprenticeships, as they're coming into the workforce, how can we best support them? So part of that is preparing the culture that's going to welcome them, whether it's construction, whether it's manufacturing, whether it's technology. How is that culture going to welcome the young workforce and meet those needs? Because the young workforce, as mentioned earlier, they are very open to talking about this, and they are looking for a psychologically safe culture when they get to work. So from that perspective, I think they're going to kind of hold organizations a little bit, feet to the fire to say, hey, what are we doing about our behavioral health?
Calling all mental health providers. Looking to specialize in treating adolescents? Check out Psych's cognitive behavioral therapy courses. Receive specialized certifications and hone in on your skills. Get 1-year access to patient videos and worksheets that you can email or text to your clients to keep them engaged in between sessions. Plus, you'll be placed on the Psych registry, where consumers of mental health who are searching for certified providers that are specialized in their condition can find you. To learn more about CBT for adolescent training, visit psychhub.com/learning. It creates another problem, another set of problems. It's just kind of interesting that I don't think we ever would have thought we would have gotten to, which is this almost diagnosis happy culture where people just sort of lead with their diagnoses. I mean, we see it so much with that age group, right? Which is, well, I have ADHD, well, I'm bipolar, and they wear it proud. And, it can be scary if you let that define you and be your identity. And so I do think the pendulum has kind of swung, and we probably need to see it move back someplace in the middle.
That's a great point. I so much to say about that. I think that there are lots of ways in which I almost call it micro-labeling, this way of kind of being very clear to define yourself in certain ways, and maybe getting away from remembering that we evolve and that we change, and that how we label ourselves will change. So yeah, that is a excellent point about feeling maybe on the other end of the spectrum of feeling very comfortable with one's diagnosis. There are times where you give the diagnosis because you have to give a diagnosis, and it can be also explaining to the individual that in order to bill your insurance company, I need to give you this diagnosis, and having that conversation so they also know where that's coming from. It's not simply kind of pasting a label on them. The others, I think that this is why lived experience stories are so powerful, because there are lots of folks living with bipolar, major depression, panic disorder, if you want to go into disorders, that are incredibly happy, productive, living life as we're all living life. And the way that one, I think, often hears that, at least if I think about myself and what I've gone through in life, or all of us, it's when you hear from somebody else that's had that same lived experience, you just hear it differently. It opens a different door.
Yeah, that's a great point about lived experience. And there's so much of that now, which I think we're seeing the stigma change over time. So, I mean, it's just like anything, we've seen progress, and yet that progress can be a little sticky as you start getting into it. You guys, I know, are in different spaces and doing quite a bit in construction. I'm curious if you've seen a difference with audiences in the workplace, depending on the type of business, whether it's corporate or construction.
Yeah, we are doing a lot of work in construction. I would say that the behavioral health needs are very much the same in some ways across all industries, because we're all struggling, or we're all one degree away from somebody that has a mental health issue or struggling or has struggled. The unique aspects of certain industries like construction, manufacturing, fishery, farmery, is that the rates of substance misuse, for example, the rates of death by suicide, depression, are higher given some of the pressures of those industries. So that's what we encounter, is the need to address it, because organizations, industries, commercial construction, home builders recognize that it's an imperative. From perspective of their growth industries. If we stay with construction, it's a growth industry. There's a labor shortage, and then if there's high rates of substance misuse, of burnout, it's harder to keep folks in the industry.
You can't help but think of all the on-the-job disability that comes from, heavy laborious work. And it's the reason why there have been real arguments over retirement age, because retirement age for some people is different from retirement age for people who've been, really doing a lot of that heavy manual labor. So I think there's but what I'm interested in is in terms of like the workers' comp side of this. That's another piece. We talk about how the healthcare industry is one, and the label helps, get you the services. In workers' comp, you got to work through the disability, right, to get back into the workplace. Could you describe what mental health is in that context? Because I think it's an kind of shaped space in the mental health world.
It is, and fantastic question. It's interesting. I can give you an example of kind of what we're doing now with a very large, one of the largest construction companies. What they actually did was identified all the ways in which they brought down their accident rates in terms of focusing on physical, the ladder, the tie-up rule, all of these kinds of safety mechanisms they had in place. And even then, they were having accidents. They were having a high rate of accidents, which they attributed to motivational reasons, which motivation, not in the sense of not wanting to do the work, but motivation in terms of focus wasn't there, the concentration wasn't there, the teamwork wasn't there, because there were mental health issues that were at play, whether it's anxiety, whether it's depression, whether it's substance misuse, the impact of that. So, and then that, has to do with accidents, workman's comp, so forth. So what we're actually doing is putting together a protocol that would be the, kind of the parallel of what's a physical safety protocol. So if somebody falls off a ladder, if somebody gets burned, what do you do? So, side by side, if there's a protocol that somebody's having panic, somebody's showing up depressed, somebody's showing up high. What do you do within a trauma-informed, empathic manner to address that so that it's not only learning for that individual, but also the team that's there? One of the things that we found anecdotally is that since we've been working more in the safety capacity, that we will have calls. We've done a lot of BH literacy, building awareness about mental health, is that folks will reach out. Some guys and women on the site will reach out and say, I'm struggling. I'm worried I'm going to pick up. I've been dry for so many years. My spouse is having a hard time. And by reaching out and getting connected to services, anecdotally, we know that there have been comp claims that have been avoided. So there's a real way to address that.
Yeah, no, I think that this is, we've really, in the policy realm, we've got to give this a lot of thought because it's like the total cost of care in healthcare. They're evaluating how to spend mental health money based upon what it saves them on the physical side.
Right.
And I think something analogous to that in the workers' comp place would be good. But, workers' comp very narrowly defined, like you get the rehab paid for, physical rehab, you get some of the medical paid for, all as it relates to the injury on the workplace site. So, but on the mental health side, there's, unless I guess if you had some really traumatic event and then needed to go to therapy in order to get help from that. But I just don't know how that gets covered.
Yeah. So we all know that EAPs are a resource that 95% of companies pay for, mid to large size companies, and they're underutilized 3 to 5%. So it's also, how do you evaluate the EAP for an organization? And really, we really are about strengthening the bridge. I think that if, and working with EAPs to ensure that they feel like they're trained up, they've got the skills to meet the needs of that population. I was told about a couple months ago, that there's some research that shows that 3 to 5 EAP sessions, which are typically what's paid for by organizations, can actually be very effective if they're focused and, kind of evidence-based and so forth.
Yeah, no, this is a new frontier. Would be anxious to kind of stay connected with you on that, because I do think when you think about first responders, that whole definition has been blown up because of COVID. You're thinking about all of those healthcare workers who have to go every day to the front lines and worry about whether they're going to bring it home, and the stress of seeing so much dying. Then so if those folks go out on disability, we're seeing our law enforcement really experience so much trauma as a result of the Black Lives Matter movement and all the spotlight that's been put on policing. And, these are really challenging times for many people, even in the distribution realm. So this would be something I think we could, really kind of collaborate on trying to think through, because we don't, we have parity in the medical space, but not sure how that applies in the workers' comp place.
Yeah, right. Yeah. Workers' comp is a completely different arena. Speaking a bit to the first responders, healthcare, peer-to-peer programs, as I know you both know, are incredibly effective. If we also think about, how do we think about care and resources more creatively? So it's not only going to see a therapist or picking up or logging in for teletherapy, but how do you turn to one another for those kinds of supports?
Yeah, we believe in that a lot, which is why we have that mental health ally cert, because we see it in that, a licensed behavioral health professional might not even be what resonates with them. It's just, everybody's very different. And just because it happens, in one period of time in their life where they, are happy to go to a marriage family therapist, another point in time in their life, a peer might be the better fit. So it isn't even just all or nothing on those one times. And I think the whole concept of peer, we're really digging in on at Psych Hub in on it. It's interesting because sometimes the peer could just be your hairdresser. It could just be somebody who you naturally kind of come in contact with, who is that person at that moment who can make a difference. It doesn't necessarily have to be someone who's come in and gotten certified as a peer. And it oftentimes it can be a faith leader. I mean, you just never know who it's going to be. It could be a random stranger who you just have a connection with that makes you feel like everything's going to be okay. Patrick and I have a friend and a colleague that is doing a startup right now, which is doing just sort of first time intervention, mental health intervention, where you just basically, you have a problem, you just want to talk to someone to help solve that problem in the moment and not go back for ongoing counseling, which is just a different way to, look about treatment. So I think we have to change too and kind of get out of almost our own arrogance that a licensed mental health provider is the end all be all, and know that, maybe there's, these tiers of need, just like there are where you fall on the spectrum. And I mean, I think that at Psych Hub, we're very focused on getting these behavioral health providers to use evidence-based practices and work at the top of their license and really move into specialists, so that when you do land with one, you land with one that is trained and certified to treat your symptoms in a very effective, more precision therapy way. But that's, we're thinking big, right? All of us together, the great work MindWise is doing, what Psych Hub's trying to do, it's going to take a lot of groups together to be kind of focusing on these same types of things.
Absolutely. And it's completely agree with you that not everybody needs to see a therapist, not everybody wants to see a therapist. So how do you build in those supports, those allies around you? So whether it's in an organization or just in our society, having these conversations much more openly, it normalizes talking about, I'm having anxiety today, the same way we talk about my tooth hurts or my leg hurts. And and people share ideas. If you've got a toothache, people often share ideas with one another as friends, as colleagues. Be nice if we could do that around things like anxiety.
Well, be nice. President Kennedy did the presidential physical fitness test, and it'd be great to have a kind of mental wellness test to the point that you're coming up with a parallel kind of protocol, right? How do we come up with analogous templates to show people that there's a template here to living in the most optimal way for your mental health? We know cognitive behavioral therapy is the standard because it helps you out of your own actions and your default thinking. But how do we proactively embed that by getting people to maybe exercise and their mental health in the way they do their physical health? There may be things proactively we could do. I would imagine part of your protocol will be for these industries to think, here are your homework assignments before you come to the job site. You really need to know how to mediate, maybe with interactive gamification of kind of these lessons. People can go through scenarios and kind of get the guide through the game, the avatar to really help you through. This is the decision making process, because like they say with parents, no one gives you the handbook, but maybe they should. Right.
Role playing is huge, I think, in terms of adopting any new behavior, any new protocol, if you will. So, when you were talking about that kind of pledge of sorts, Patrick, it reminded me, for instance, in terms of certain groups, you may know the American Bar Association a couple of years ago really encourages lawyers and legal firms to take a wellness pledge. And so there are, I think, 7-9 pillars of what that looks like. What do you do in terms of supporting your mental health and addressing substance misuse needs?
And it has to be, I like, because screen in, screen out, the whole idea is this has got to be ubiquitous. We're so focused, like I said, like you said, on what's your temperature at that moment. I think it's got to be, it's got me thinking a little bit differently even before, Marjorie, about our screening. Like, I think our screening's going to be good, but we should just do a proactive, universal resource hub for folks to learn more. And they'll apply it based upon their own interest and so forth. But framing it not as a mental health issue, but as a learning issue, I think could help us a lot and get wider adoption earlier, because it really is an education issue. And the military doesn't frame it as a mental health issue. They frame it as a readiness issue, right? They put the special forces through very regimented training to deal with stress, because it's not a, are you fit, or are you strong, and can you power through it? No, here are the skills you need, because you're going to be in situations where you're going to deploy these skills just as much as you deploy your marksmanship training, right? And your ability to process the stress of what it's like when your helicopter goes down, you've been captured, what have you, those skills are vital to the mission. And I suppose with the workplace, that's the same type of template. And then if we can start to inculcate that earlier in the schools, there's a real, like you said, a natural acculturation to this whole process as normative, so that there isn't this, I got, the scarlet letter, which is why a lot of people don't want to seek services in schools, because they don't want their kid to be labeled. And that goes back to our point before, that you get a diagnosis once, it's like it sticks to you for the rest of your life.
Exactly. And taking that developmental approach, whether it's with kids, whether it's where you are in your professional development, remembering that developmentally people look differently, our mental health looks differently based on where we are. So I would say, in terms of organizations, schools, the work that is being done in schools, it's looking at the culture, and then it's also looking at the actionable items of what does leadership need to do, what trainings, what resources, what affinity groups, what teacher support groups, what in athletics, not only supporting student athletes, but supporting the coaches and athletic directors as well.
Lisa, we always, this has been so fascinating. We always ask our guests as we wrap up one final question, which is, if you had a magic wand and you could make the future of mental health any way you wanted, what would you do?
If I had a magic wand, I'd do a lot of things. Sticking to mental health. I think very much along the lines of what we're talking about, making it part of the whole, that mental health would be part of our whole health. And that we would really think about it in a way that we do our mental health. I have always thought, since doing clinical work, that we've got a primary care doctor, we've got a pediatrician. Why don't we have a therapist to check in with, that members of the family can check in if there's a bump in the road, because we all have bumps in the road. So I guess my magic wand would say, hey, it's part of our overall health.
That's great. This was so wonderful and so interesting. And I just am really grateful that there are people like you out there that are, being innovative and thinking about things deeply, and not just kind of doing things the old way, right? As we think about what does the future look like, it's people like you that are creating a better future for all of us. And so I'm grateful for your time, and also just for what you're doing out there, and you're making a difference in so many lives. So I just wanted to say thank you for taking some time with us today.
Oh, it was a total pleasure. And thank you for all the work that both of you are doing. Delighted to be here. And again, thank you.
What's cracking, Hope Nation? It's your friend in the neighborhood, Kevin Hines. And here is your Psych Hub Brain Health Tip of the week. Be forgiving. Be forgiving of your past mistakes and the mistakes of those around you. Sometimes we assume other people's intent and that they have good intentions. Look for the good in yourself and the people around you, and believe that they are trying to act in a way that is fair. Psych Hub actually has a course on unconscious bias that I highly recommend you take a look at and check out. For actionable strategies on this, visit psychhub.com/psych. psych.com/learning.
As always, thank you for listening to our podcast.
If you enjoyed the show, drop us a review.
If you haven't already, subscribe to our podcast for the latest episodes.
For the latest insights, check us out at psych.com.
Looking to grow your behavioral health practice and reach more clients who need your help? We have just the solution for you. Psych Hub Provider Learning Hubs are your answer. We will train you in the greatest information on evidence-based practice delivered by industry experts in a state-of-the-art way. And at the end of it, you will earn a certification in how to use these interventions to treat anxiety, depression, insomnia, you name it. And then when you finish, you unlock a whole library of resources for ongoing learning for you as the provider, but to share with your patient. How great is it to let your patient know in a quick video, here's what to expect from your therapy session. And then any exercise or activities that happen in session, we have videos to help reinforce those skills at home for your patients, as easy as just sending a quick text or emailing them. It is a revolutionary new way to really get people through treatment, getting the best symptom results, and engaging your patient along the way. Visit psychhub.com/learning to get started.